We don't know, and I'm not ready to risk my family for that.
Quebec doctors say they've noticed that the number of pregnant women with COVID-19 is at an all-time high since the beginning of the pandemic, with the province now in a sixth wave. Omicron's BA.2 subvariant, highly contagious. Health professionals say an increase of infection across the population is to be expected, and those expecting are no exception.
In the last couple of weekends, especially over the weekend, it was really impressive, the amount of patients that came in with COVID.
I haven't really made it official, so I think this is going to be the first real big public announcement. I didn't post it on my social media.
Miranda Serekia, mother of one, soon to be two, is one of many pregnant women during the global pandemic. But doing what she can to dodge the virus isn't the only feat she's experienced over the last few years.
Oh gosh, this is actually my second pandemic pregnancy. My first was right at the beginning of the pandemic. It happened end of May 2020. Unfortunately, I lost that one in August 2020.
After her miscarriage, finding out she was pregnant again was bittersweet, as the news came the same week her son contracted COVID-19.
When they're sick, they just want mommy, they just want to cuddle. And so he was like, all up in this space, it's hard not to share contact or share germs at that point. But luckily, I tested negative.
Dr. Diane Francoeur, a gynecologist who works at Sainte-Justine Hospital, says she's seen many pregnant patients coming in because they have COVID symptoms or the virus itself. And she's been getting calls from patients worried about what it means for them and for their deliveries in hospital.
We had patients who had been really sick, they had to be intubated and didn't see their baby for weeks and even months. So you never know how it's going to end until it's over. So it's better to be careful.
Having COVID-19 can impede the placenta's ability to properly provide oxygen to the baby. And that's why it can cause problems for the baby if a pregnant woman does develop COVID.
Dr. Jessie Papenberg from the Montreal Children's Hospital has noticed the increase as well and says social contacts must be limited and vaccinations critical.
We know that community levels of transmission remain very high in Montreal, and that means that pregnant women, as part of the population that's out there mixing and socializing or going to work and doing all the things that they need to do, are at risk for getting infected.
As for Serekia, she says she's being extra cautious, but looking forward to seeing her son become a big brother.
It's a little boy. It's a little boy. I'm a boy mom. Yeah. Don't have a name yet. So if anybody has suggestions, I'm totally open, but it's another little boy. We're very happy, very excited.
In Montreal, Pamela Pagano, City News.
Next on